Ladies and gentlemen, esteemed panelists and distinguished guests, welcome to the second edition of Leaders Roundtable 2023 Collaborative Action for Healthcare Equity. Welcome to the second panel, MedTech, Pharmaceutical and Life Sciences Industries Impact and Contribution towards Universal Health Coverage. This series is organized by Voice of Healthcare with the support of United Nations Global Compact Network India, Parul University and Parul Sevashram Hospital, and BR Life, a healthcare initiative of BRS Ventures. Today, we are honored to have our esteemed experts joining to shed their light on the various facets of this global crucial initiative, Universal Health Coverage. Allow me to welcome my panelists. We have Dr. Rajiv Chhibber, Vice President, External Affairs, Sahajanand Medical Technologies Private Limited. Hi, sir. It's
Hi,
lovely to have you. We have Mr. Prabhat Sinha, Director, Public and Government Affairs, Corporate Affairs, Boehringer Ingelheim India Private Limited. Good afternoon, sir.
Good afternoon.
We have Dr. Monika Puri, Chief Country Access and Policy Officer at Roche Products India Private Limited. We have Mr. Sharad Goswami, Senior Director, Global Policy and International Public Affairs at Pfizer. Good afternoon, sir.
Hello, everyone.
And we have Dr. Ravi Rathore, General Manager, Policy and Strategic Affairs at IITPL. Hi, Doctor. Thank you for joining.
Hi, Nishan.
So to start this discussion, I'll start with the first round of discussion. My first question will be for Dr. Rajiv Chhibber. Dr. Rajiv, in the MedTech industry, what role do collaborations between industry players and government entities play in advancing the Made in India initiative as we know, and particularly in improving the healthcare access for the diverse population as we have in India, please?
Yeah, thanks, Dr. Nishant. And first of all, on Universal Health Coverage Day, wishing everyone, a great health and great collaborations as the theme says. So it's a very good question and a very pertinent question, and I'm glad that the first question is actually asked from a medtech perspective, because over the past couple of years, the medical devices has kind of like been looked over as the dwarfed cousin of the pharmaceutical industries. But then post-COVID, there's been enough momentum where the Honorable Prime Minister himself has reached out to the medtech sector and called it the sunshine sector. But yes, I think collaborations have an immense value, and we've seen during COVID also, if you look at the entire stretch of the last 2.5, 3 years, there's been immense traction towards the medtech sector. And largely, while the central government has been weaving the entire spiel around medical devices, the medical devices policy, the public, the PLI scheme, the production link incentive schemes, etc., I think a lot of state governments have also reached out in their individual manners. While 4 state governments have been allocated the medical devices parks so that we can have large domestic manufacturing done here in India. This has actually made something, the AAAs more affordable, accessible, and available to a larger population. And when we talk about a larger population, this is a population which earlier was not counted in. And I'm talking about, the peri-urban, the rural population, the population in tier 3 and tier 4 cities in that sense. So I think with new age medical devices, with newer technologies and innovation being now available in the country, this is the right time to have forged collaborations. Indian companies and even MNCs equally are making good headways in the country itself. We've got huge manufacturing and R&D units which are being rolled out on a regular basis year over the year. You look at even my company SMT. We've come out with within the PLI scheme a new set of cardiac devices and cardiac products which are going to be available at an accessible at an affordable cost itself. So these are things which will really forge more and more um, collaboration chances with Ayushman Bharat, with CGHS, with a lot of state government schemes, and that actually reaches and percolates down to a lot of people who otherwise would not have access to it. Similarly, you look at Medtronics; they've got their largest R&D center out of Hyderabad. It's immensely giving value towards how clinical trials, RCT data is going to be looked at, and how are we going to look at policies that are going to be built towards NCDs, which are going to be built towards maternal child health and diseases that really require rare diseases now, which require large attention. So that's there. Hospital setups, hospitals are collaborating in a big way, whether it is through the government itself or with MedTech companies, pharma companies itself. So those are going to be big game changers in the next couple of years. So I think the road ahead on collaborations, the road ahead on partnerships is actually going to convert what UHC really stands for when we talk about accessible, affordable, and available healthcare to all. So I think it's a great collaboration that we're looking at in the next couple of years. And India obviously is when we look towards 2030 and when we look towards the 2047 goals that we as a country are looking towards during the Amrit Kal. It's something which is going to really make more headways in the healthcare sector.
Thank you, Dr. Rajiv, for that wonderful answer and setting the tone of this discussion, starting with MedTech. Mr. Prabhat, my next question is for you, talking about the pharmaceutical side of this panel. So, in the pharmaceutical industry's efforts concerning the non-communicable diseases research and patient-related initiatives, how do you feel that these endeavors can align more effectively with the broader objective of enhancing healthcare accessibility and the broad topic of UHC? Please, Mr. Prabhat.
Thank you, Dr. Nishant. I think while we talk about universal health access, I think it's a process, it's a goal, right? We will reach there in a stepwise manner. But I think there has been some significant collaboration partnership that is happening along with, let's say, Ayushman Bharat, which is a flagship program for Government of India. But even other than that, there has been significant partnership, especially from Pharma, many partnerships which we can recall, which is actually kind of helping in terms of the whole patient journey from screening till treatment, equipping the healthcare workforce, uh, enabling system, for example, to a larger extent. And the point what you raised is what role pharma and also the patient group plays, right? Because uh, patients, majority of the time, if you see, they are, especially in our country, they are mostly the beneficiary of in this whole healthcare system, right? They have never been part of the process where they are also part of the planning process. But over the year, I think, thanks to many of the companies where they have really started empowering these groups, uh, involving them in the decision making process, and also supporting them, because at the ground zero level, uh, I think the trust that the patient community have on patient organizations, that is very high. To leverage that, I think that is one. I'll just give you an example in NCD, since we are talking of a stroke care, where currently Boehringer Ingelheim has a lot of partnerships with states and also with some of the private sectors. Because in stroke care, even if you have, let's say, a drug available in a healthcare system, or a trained manpower available there, but if your whole ecosystem at that hospital is not working, then you may not be able to treat that patient in that stipulated 4.5 hours of window. And in those setting, partnerships are so important, and we have a program called Angels Initiative, where we actually partner with state government and train the entire workforce in that hospital, from ambulatory staff to the general physician or the hospitals at district level, because many times from districts, patient may not come to a tertiary care center at state capital. Punjab, Haryana, these are the two examples where at district level now, for example, patients are treated at district hospital because of almost 2 years of intervention with these district hospital, slowly training them, equipping them, and government also has put a lot of infrastructure into that. So, I think the trust between partners is key. So whether it's a government sector, patient organizations, pharma industry, I think once the trust is there between the three party, I think access becomes easier. And we have many examples from stroke to diabetes care to cancer care. But I think the key point is that trust and mutual respect in this partnership, that each one comes with a very clear cut strength. So I'll stop here and
Thank you, Mr. Prabhat. I think a very, very wonderful example that you quoted that BI is currently involved with. So my first question for you will be: how is the pharmaceutical and the life sciences industry in India contributing to universal health coverage through initiatives that improve affordability, access, and the quality of healthcare solutions and vaccines and medicines, as we know?
Great. Thanks for the opportunity on this very special day of universal health coverage. I would like to share my viewpoint before starting. What does it really mean to have universal health coverage? I mean, in very simple words, I think universal health coverage would mean that every patient or an individual who requires essential health services is being able to receive them at a cost which do not put him through any financial hardship. When I talk about this, I also mean, as it is part of the UN SDG goal as well, that we should not leave anyone behind. And that is the power of universal health coverage. Why am I saying this? Is that we have learned this over a period of time, whether as a medical doctor myself or working for UN, WHO, CRO, or now working for the corporate sector, that access is a multifaceted challenge. You cannot solve for improving healthcare if you've not looked into the entire patient journey pathway. What I mean here is that right from the time, a person is aware whether he has a disease or not, to the time when he adheres to a treatment, there are so many challenges a patient can go through, whether it is about early diagnosis, whether it is about treatment, whether it is about standard of care treatment, and who's going to pay for it, and eventually whether he adheres to the treatment or not. Till the time we don't solve for all these problems in one go, we will never be able to achieve universal health coverage. And to that point, I would also like to mention that if there's one thing that COVID has taught this world, is that no government can do it. No private company can do it. No non-profit civil society can do it. We all have to come together to make sure that we provide for affordable, accessible, and quality healthcare. And that is why I think now I would like to focus on the role of private sector as industry. What are we bringing to the table? I think the biggest thing that we are bringing to the table is the access to innovation. And why am I saying that? Is also because if you know historically, I mean, almost a decade ago, when there's any woman in India who is getting, diagnosed as breast cancer, she would feel that she's got a death sentence. But that's not the story today. Now, women with breast cancer are actually treatable. And that's the power of innovation. And what we want to try to solve for is that innovation is not just that happens in the northern part of hemisphere. Innovation is also when it reaches to the patients for whom it means the most. And the power of the industry is that we are innovating and we are providing those quality medicines, diagnostics, and vaccines to everyone who requires the most. And now I would also like to emphasize on the point when I said, leaving no one behind, which is actually the core theme of universal health coverage, that we all have been thinking about communicable diseases so far, whether it's TB, it's malaria, whether it's AIDS, it's hepatitis. We have as a society, neglected the non communicable diseases and rare diseases for a long, long period.
Correct.
And this is the time we need to focus on all rare diseases as well, so that we can truly say that there's no one who's being left behind. A lot has been put to test and to investment when it comes to looking for specially therapies for very very rare diseases as well. So we are actually innovating and bringing best of the class quality treatments for even rare diseases like SMA, spinal muscular atrophy, I mean, hemophilia, which were diseases which we had never even talked about. And we are bringing now best of the class treatment for cancers also. And I think another thing that I would like to emphasize, and all, congratulations to the academia and the research bodies also, we are actually innovating in our own local, indigenous way as well. I mean, look at how we came up with two best of the world class vaccines during the COVID crisis. It would have been possible. And we've not only served our own nation, we have actually served so many nations outside of India. For me, that is the true essence of universal health coverage, where not just thinking about essential health services, but you're also preparing the healthcare systems for future pandemics and making those health systems so robust and resilient that if God forbid we have another crisis, we can pick up those early signals, we can test early, diagnose early, and we can treat faster. So for me, that is the true essence of how industry is coming up and solving for universal health coverage.
Right. A very, very nicely summed up answer, Dr. Monica. And thank you for also elaborating on your views about what you feel and is about universal health coverage. So while you just spoke of the industry, now I'd like to understand your views on the industry collaboration with the different stakeholders. So my question is that how does the industry collaborate with stakeholders to ensure equitable access of healthcare solutions across the diverse regions that we see in India? And I'll also like you to emphasize on any particularly effective partnerships in your views that have advanced UHC, as you know, please.
Sure, sure. So I would like to speak on behalf of the innovative pharma industry first. And the reason for that is something very close to my heart, and I've really seen the impact on the ground. I think India is a land of opportunities as well as challenges. What happens in down south Kerala, which is like one of the best class healthcare systems, is probably not the same story for other parts of India as well. So you really have to look into the local healthcare ecosystem to first understand the challenges. And that is why we took a very comprehensive approach in terms of looking at our own portfolio, which means looking at our own strength, what can we bring to the table, and looking at the opportunities on the ground. What does the government really need? What does the patient really need? So that we can have a triple win in terms of what industry wants, what the health system wants, and what the patient really want. And that is why most of our projects are based upon looking at a common shared goal of how do we deliver equitable healthcare across different geographies. And one of the examples that I can proudly share with you is we also understand that for bringing better and better innovations, we need to have those research and clinical trials on the ground. So looking at India, where we have 17% of the world's population, but if you look at global clinical trials, we hardly have any representation from India. So what we really want to work is to upgrade the clinical trial facilities and different hospitals of India. And we have really partnered with 5 for now and going up to 10 government hospitals in India, where we are building up the clinical research observatories, we are upgrading the healthcare infrastructure. So they are like best of the class clinical trial research facilities that we can have in India. Another partnership that we have looked into is also to understand the healthcare ecosystem and how do we draw learnings from there to build up a comprehensive roadmap for cancer care. As you know, cancer is multivariate, and one really needs to focus on like I said, what are the diagnostics facilities available, what are the sort of doctors oncologies available, what are the care options available, and who's going to fund for it. So really working with the entire ecosystem, we have signed up MOUs with 3 major states of India, and we are working with the government to help them understand the healthcare ecosystems, provide technical and knowledge support, and really scale up the health system to a maturity where innovations can come in. Another thing that we have looked into the space of hemophilia care, because it is also a very neglected sort of rare disease in some parts of the country. And we really wanted to bring evidence based policy change in terms of treating hemophilia in India as well. And we are working with many state governments of India to make sure that it becomes a priority, make sure there's evidence for cost effectiveness of the treatment, and then really scale it to make a stronger case for every penny that government is spending. They're actually getting a much higher return on investment. That means we are making health systems more efficient to really make a case for affordability and getting the best of the quality treatments for India.
Right, right. I think UHC, if we sum up, there could be a lot of definitions, but accessibility, affordability, and quality healthcare to everyone. Mr. Sharad, my next question will be for you. Now, moving over to the vaccine sector, how does the industry collaborate to ensure equitable access of vaccines across different demographics, thereby contributing to the broader goal of UHC? Please.
Yeah, thanks a lot for that. And before I start, my congratulations to Voice of Healthcare. You're picking up this topic of universal healthcare, which is such an important discussion point. So I really want to thank you for bringing light to this topic. And like everybody said, to start with, we are all so thrilled to see the success of Ayushman Bharat. This is really the boldest step that our country has taken in this journey towards universal healthcare. And given the kind of cover and the size of population that's under the protective umbrella of this program, it's quite evident that the day is not far when we can actually offer a right to health to all our citizens through a program like this. So we've taken a very, very positive and a very large step in that direction. When it comes to immunization, I think one thing is quite clear. The value of immunization is now very well established in our public health system. Uh, Perhaps to some extent, the COVID experience has also shown us that it is not just pediatric or children who will benefit from immunization, but as we spread the concept of immunization amongst non-pediatric populations, the benefits are huge. Um, in this direction, clearly, we need to start thinking about diseases which today are vaccine preventable and have high burden of morbidity and mortality. I always use the example of pneumonia because that's one area where we have a lot of experience. Some data points can bring this to life for you. The risk of pneumonia is as high in a 65-year-old as it is in a newborn, right? Thankfully, today our newborn are being covered through the universal immunization program, where pneumonia vaccination, amongst many other vaccinations, are being provided. But how do we look at the 65 plus population, for example, who are at the same level of risk but today have no protection against a disease like this? And not just the burden of disease, we also know that one out of every five elderly patients with pneumonia will get readmitted with pneumonia within 30 days, one out of every three in 1 year. So it makes a lot of sense for us to now look at how do we expand this concept of adult immunization. The challenge is clearly there. I mean, it's a large population. We obviously cannot immediately look at universal elderly or adult immunization. But again, going back on the COVID experience, we know that there is a way to stratify the population. So if you look at a 65 plus population with one or two of the most prevalent comorbidities, you are able to narrow down a population that could be a priority for this kind of an intervention. And unlike pediatric, in adults, it's basically one shot and you're protected for life. So I think that's the way that we need to start looking at creating these manageable use cases, which are most logical, most obvious, and see how we can actually extend the benefit of immunization to these populations. This is what will require some creative thinking, some partnership between the industry and the government and other stakeholders. But I'm convinced that this is the way to go if we really want to get the benefit of immunization for our non-pediatric population as well.
Right. Thank you, Mr. Sharad, for that answer. Dr. Ravi, my next question will be for you. So, as a part of the medtech industry, how do collaborative efforts ensure the widespread availability of affordable and quality medical devices spreading across the different regions of India? We'd like to hear your opinions on that.
Thank you, Dr. Nishant, and thank you for the opportunity. So, on the collaborative efforts, Dr. Chhibber has already talked on the overall perspective. What we can discuss is, collaborative efforts with the regulatory bodies, because we do have a lot of regulatory challenges in the country. For the medtech, as medtech is a growing sector, sunrise sector, and the industry faces a lot of challenges in the medtech front. So what we can do is there are some strategies we can follow and we can incorporate, where there are two ways responsibility from the industry side as well as from the regulatory body side. So we can start with the communication, the early and transparent communication by the industry from the early stage of product development, while the responsibility of regulatory bodies to provide the clear guidelines and the expectations from the industry players, so that fosters the mutual understanding of requirement. That's one. Second, we face a lot of difficulty in terms of the standards harmonization. We Health is a state subject. We have a central and state regulatory bodies. So harmonization of standard is one of the strategy to improve the accessibility of the medical devices in the market, also with the regulatory challenges, where the industry can align with the internationally recognized standards, best practices to streamline the regulatory approval process, while the regulatory bodies should also participate in such international collaborations, standard harmonization, to facilitate the smoother approvals for a product that meets the global benchmark. That's the important front. State and central government collaborative efforts, inter-ministerial duplication to be avoided. That are some of the points on the standards harmonization. Third thing we can look at on the industry and regulatory front are the capacity building and training. Our CDSO has the strong has made a strong efforts recently for the medtech industry, but there are still we can say we need to have a lot of training programs and capacity building programs at the regulatory perspective, where the industry must, from the industry side also, industry also must invest in the training programs for regulatory compliance, so that to enhance the understanding of the regulatory requirements. Vice versa, the regulatory bodies should offer the educational programs, resources to help the industry so that they can navigate the regulatory landscape and comply with the new evolving standards. Uh, we can say regulatory bodies should also involves the industry experts in these training programs, so that regulators also on the same front understood the ground level regulatory challenges which the industry faces. Fourth point we can say is the regular interaction between the stakeholders, industry, regulators, policy, so that the policy updates can be discussed, the challenges can be discussed, and the potential solutions we can find out. we can we have to provide a platform where industry players can share their experiences, exchange information to provide the inputs on the regulatory processes. So these are some of the points, by fostering this such collaborative relationship, industry players and regulatory bodies can really work together to navigate the complexities of the healthcare product development and the approval to make, to ensure that the safe and effective solutions reach the public in timely manner. That's most important, to reach these advanced technological innovations and medical devices, reach the population in a timely manner. This approach will contribute on for an innovation, regulatory efficiency, and this will ultimately improve the public health outcomes. So, uh, those are some of the points we can incorporate.
Thank you, Dr. Ravi, for sharing your recommendations. Really wonderful answer. Moving over to the next round of discussion, I'll start with Dr. Rajiv. Dr. Rajiv, my question for you is how influential do you think is policy advocacy in driving the Made in India initiative, ensuring healthcare accessibility for all, especially from a MedTech industry's perspective? Please. You're on mute. Yes, please.
Yeah. So, no, it's another great question. In fact, policies have always been enablers, and now with the economy really growing at a pace that the world is looking at India as a hub, uh, enabling policies always help the industry as well as percolate down to the patient centricity that we are focusing on. So, from a medical device perspective, if you look at it, again, going back to my previous response, during COVID, we could see that how a change in policy or how a tweak in policy could actually make huge scales in the production of key medical devices, which are life-saving devices. If you look at rapid antigen test kits, real-time reverse tests and all that, RT-PCR kits, your thermometers, PPE kits, N95 masks, even large-scale production of other medtech infrastructure that was also being mooted at that time. That has now helped India to really become a real-time medtech hub, which otherwise within the Asian periphery we were within the first 20 or slightly below than that. Today, if you look at it, in medical devices, India has reached the fifth stage in that sense. I mean, we're one of the largest hubs in Asia. We are now growing ourselves in the entire global community itself. We are preferred in Europe, we're preferred in the Middle East, we're preferred in African nations itself. That's where there's a lot of demand that is going to rise. It's the emerging economies that are now looking up to India also on this. But yes, a lot of policies over the last couple of years has really made this possible. If you look at it, just take a look at the National Medical Devices Policy 23, released by DOP, Ministry of Health and Family Welfare, Dr. Mansukh Mandavia, having it for the industry, looks at certain key things that really have transpired into ease of doing business. Now that helps a lot, right from regulatory streamlining. Look at the entire CDSO or DCGI working, not only in the central government but also state governments also having that wariness towards how regulatory processes are going to be now given the speed approvals that are required. The international, uh, peripheral really being harmonized in that sense. That's going to be something which is very important. Harmonizing other departments also within the government itself, because unfortunately within healthcare we have too many regulators. AERB is there. We've got the Department of Pharmaceuticals, DPIIT. We've got NPPA. There are too many departments which are within that peripheral of regulations which we have to look into. All those have really been streamlined in the last couple of years. Enabling infrastructure, if you look at it, that's really taken a 360-degree turn itself. If you look at the medical device clusters itself, they have been given a lot of impetus on R&D. A lot of impetus is on how new age medical devices can be looked into, wearables, your IT-enabled medtech devices. These are things that are really now being manufactured at a lower cost in India, available, accessible to a large set of population itself, and within the government and the state government programs itself. Sharad and others, we spoke about the huge Ayushman Bharat program. It's really engulfed all of this. It really has. Gati Shakti program, logistically, if you look at it, it's dovetailing the entire nation with not only life sciences or the healthcare sector, but others also. So, that's made it more easier for us to have a planned way of management in that sense. Huge impetus on facilitating R&D and innovation, whether it's a TOT, whether it's homegrown innovation. We've got ICMR, we've got BIRAC, we've got other institutions who are supporting a lot of medtech industries, a lot of startups in that sense. They've been now bustling with proposals. They've been now getting more and more, I think, affordable technologies, which is going to be available to a large population, and that is what UHC actually requires to have. I mean, when you have a lot of people having accessibility, availability, affordability, coming back to the three A's, that's something which we need to look at. Again, I mean, even in that sense, MNCs, I mean, we've attracted a lot of, clout here within India also. The FDIs are there. We've got, schemes and interventions, Heal in India, startup missions. We've got venture capitalists, public-private partnerships which are really entering state governments also, and creating these giant mammoth centers or hubs which are actually helping a lot of manufacturing here in India, a lot of innovation here in India, R&D here in India. So that's there. And the last is, like the IT sector, we are now growing in the human resources in healthcare also. Skilling, reskilling, upskilling of professionals is going to be something which is, I mean, we started it off pretty early through Niti Aayog, and now each and every state is doling out SOPs and subsidies around it. So you can actually get the talent pool that you require in the medtech sector. Traditionally, if you were looking at someone within the medical devices sector, you had to convert a pharmacist into someone who could understand metallurgy and the combination of life sciences. Today, we've got medtech courses, PhDs in medtech also being available. NIPERs are there. We've got ISBs. We've got IIHMR. We've got other institutions that are actually training a lot of young professionals and making them available for the industry. So I think multidisciplinary courses also, these are bridge courses that are now available. Even the Ministry of Corporate Affairs is coming up with bridge courses in medical devices, which was like largely unheard of. And then that too under the MII, the Make in India perspective itself. So I think we've got enough of the entire outlook that we required in terms of how the medtech industry is now going to contribute to a larger life sciences or the healthcare industry itself. So I think with such enabling policies, it is expected to provide the required support and directions to strengthen the medical device industry into a really competent, self-reliant, which is the Atmanirbhar Bharat that we're talking about, resilient and innovative industry in the coming years itself. And this places medical devices at an accelerated growth of path itself, with a patient-centric approach. Ultimately, what is Ayushman Bharat? It is providing the last mile connectivity towards healthcare for everyone. So
Correct.
I think enabling policies have always helped, and they are required for not only ease of doing business but also ease of accessing healthcare within the country.
Right. Thank you, Dr. Rajiv. That was a really wonderful example and an answer. Mr. Prabhat, my next question will be for you. So, as in the previous question, and as Dr. Rajiv was also mentioning, I'd like you to elaborate on how the industry engages in public private partnerships to ensure healthcare solutions are accessible across the different regions of India. And we'd like to hear some examples showcasing the success of such partnerships from you, please.
Yeah, glad that you asked this question. See, I think first thing is, do we have enough public-private partnership examples in healthcare, and especially in the service delivery model compared to the evolution that has happened in public-private partnership, be it roads or managing airports. There are many examples where actually public-private partnerships have shaped the entire ecosystem, and the access to that quality services is a norm. But when we look at healthcare, starting from primary care, or the lowest pillar of Ayushman Bharat program, when we talk about health and wellness center, do we have enough model where a kind of a private player is working with government to kind of run the very basic health and wellness center? Very few, right? And this has been a discussion always, that uh, to enable this, do we have enough framework or a kind of a process that exists? Otherwise, now we see whenever there is an infrastructure development or such, you see that there is a public-private partnership. But when it comes to healthcare delivery, we don't have many examples, right? Uh, Diagnostic, for example, is a very good example. Now even at district level, majority of district hospital, you have a diagnostic partner along with state government, who is actually where the diagnostic services are outsourced, and that has changed a lot when it comes to diagnosis. But when it comes to treatment of anything starting from diabetes to cancer care, do we have such strong models of public-private partnership that exist? Even if we have very few such models. So first, there is a huge need of coming up with more and more enabling framework which allows such partnership to happen, right? Now, to give you an example, as you have asked for, again going back to stroke care, for example, we have the Angels initiative, where we have been working for last many years. 2 3 years back, almost 4 years back, when we started exploring partnership with state government, you have to go and pitch to the state government and say that we have a global initiative and we really want to help. But the time you lose in terms of convincing that this is something which is only on disease management, this is not related to any brand, this is to support that healthcare ecosystem, it takes a lot of time. And it also depends whether you have a right person there at the state government who is listening to you and who will transform. And whenever such partnerships are running or have happened, it's because of a champion that we got in that system who actually took it forward, right? To and the whole process, starts with this dialogue and discussion. And to give you a success, is Punjab and Haryana, as I was telling, these two states at district level, there was no stroke care services. And again, giving stroke care services requires a lot of multidisciplinary collaboration at the hospital. You need infrastructure from CT scan to a lot of training. Now, to even how do you bring these people together to have a dialogue with this? And that's why whenever we have, in these two cases, we have an MOU with the state government. Once we have signed an MOU with the state, we kind of agree on what is that the state has to facilitate in this whole process and what company has to give. Now, giving infrastructure support to the district, setting up the CT scan machine, assigning a kind of a medical officer for that stroke care, so that and not only for a shorter time, but also to ensure that the person is there for a little longer time. Otherwise, once you train them, then after 6 months or 1 year, that person is no longer there. Now, these districts, and then our responsibility from Pharma was to ensure that how do we train these people, right? Give them all those training inputs, do a kind of a standardization of the process, develop those SOPs, small manuals for different stakeholders. Now, very happy to report that now these districts have now started tackling stroke care. In many of these districts in Punjab now, 3 to 4 patients every month, whenever they reach to these district hospitals, they actually get the services, because the medical officers, not the neurologist at those district hospitals, have started giving stroke care, and it's life saving, right? And there are similarly, we have recently started a partnership in Maharashtra, for example. Again, same. State government has given us 5 districts, and now based on those districts, both the parties work together, identify what are their core strength, and then we work together. So I think there are this is one of the way that this partnership works, and I'm sure there are many other examples happening at district level, at tertiary care level, that is happening. But to sum up again, many of these models sometime remains at that place, right? There is also a need in a country of our size to scale up these models, to replicate these models, and this will only happen when there is a framework, there is a system that actually welcomes you for these PPP models, because it's sometimes it is not as tangible as making roads of this many kilometer, and then you are being paid for that or something. So that framework is needed, and I think some of the states really is very progressive in that way, but not every state. Sometimes the states where we need more support, I think those states you will see very few public-private partnerships. Some of the evolving state which are better in terms of healthcare system, more and more partners are there, but not in the state which actually need this type of care.
Some really wonderful recommendations, Mr. Prabhat. Thank you for your answer. Mr. Sharad, my next question will be for you. Now, looking at the immunization sector as a whole, what innovative strategies or collaborations could improve the equitable distribution and accessibility of adult vaccines, and particularly for the underserved population? I'd like to hear from you, please.
Thank you, Dr. Nishant. And with your permission, I'll break this down into two parts. We'll first obviously talk a little again about vaccines, but given that we spoke about this also, I would also in the latter part of my comments go back to Ayushman Bharat, go back to universal healthcare, and talk a little bit about how do we now further expand and further enhance this program, which, like we've all been saying, is really the pathway to universal healthcare. If you look at vaccination or immunization, and your question was, how do we create an approach which serves especially those who are underserved? And there are numerous examples of that. I mean, I can give you case studies of state governments, who said, before we look at universal elderly immunization, can we look at specific groups? So I know that there is a bunch of states who said, let's look at immunizing inmates of our old age homes, because this is a population that is directly under the care and protection of the state. And given the value that immunization can bring and prevent mortality and morbidity, that kind of an approach was followed, and companies became partners, and this kind of immunization programs were run. I don't see a reason why more and more states can actually start with that kind of an implementation. Look at that as a starting cohort, if you will. In several other examples, and in fact, Prabhat knows this very well, sickle cell disease, for example, as one of the comorbid conditions. Again, it's a disease that predominantly affects tribal populations. These are vulnerable populations that are often left behind. And there was value established in protecting patients who have sickle cell disease from life-threatening communicable diseases. And so we know that multiple states have either started or are about to start immunization programs to protect these populations, these patients, from diseases that they can catch more than others because of the fact that they are sickle cell disease patients. That could be another very good way to protect the most vulnerable, the most marginalized populations. So these are ways in which both the central as well as state governments can look at extending the benefit of immunization. And the entire industry, and I don't just speak for us, will stand ready as partners and make sure that this is possible, this is affordable, and this can actually be implemented. So that was my part about how do you do the vaccination piece. But then I'd also like to now take a step back and say, if you look at Ayushman Bharat, and if you look at, for example, oncology as one disease area. In fact, let's take a step back. Here is a program that was started in 2018, and at the time had, about 1,400 packages. In less than 5 years, today we have a situation where there are 2,000 packages. Look at the way in which the government has really expanded the scope of care that this program today offers. Even procedures as high-end as bone marrow transplant are also now included in this program. 24 new oncology therapies have been added. So clearly this program is going in the right direction, and the intention is that beneficiaries who are today the bottom 40% of the population do not need to look anywhere other than this program to be able to meet their healthcare needs. Now, as this program expands, we will start looking at more and more, let's call it high-end procedures and higher-end therapies, innovative therapies, to be offered to these populations. And I think this is where all of us, along with the government and experts, need to put our heads together and say, given limitation of budgets, given some of those challenges that will always exist in a country of our size and scale, how do we create innovative approaches such that a beneficiary of this program is able to get access to all the latest breakthroughs, whether it is on the device side or it's in the pharmaceutical side, that anybody else outside this program gets. So, our HTA models, for example, really will need to evolve. The fact is we are a low GDP per capita country. We are at about $2,200 GDP per capita. So the minute you look at the classical HTA construct, 1x GDP per quali, we are not going to come to a solution where these new age, more modern therapeutics can be made available. So how do we develop customized to India models, so that you have modifiers, you have adaptive HTAs, so that more and more of these therapies are going to become available. Medical science is really evolving at a very, very fast pace. Again, both on therapeutics as well as on diagnostics. And these therapies should increasingly become a part of this program. So I think that's one area where stakeholders need to sit together, look at global examples of countries which have a similar GDP per capita as we do, and say how is it that we can learn from them and apply our unique situation that we have in India and create models so that more and more of these therapies, these innovations can become available through public payer programs. That I think is really the way to go further and further towards universal healthcare.
Thank you, Mr. Sharad, for that wonderful answer. Really insightful. Dr. Ravi, my last question to you for this round of discussion will be in the context of MedTech industry's evolution. How do you envision the collaborative and the collective industry efforts in contributing to the future of healthcare accessibility in India, especially in terms of medical equipment adoption and affordability? You will have to unmute yourself, please.
Yes.
Yeah.
So on the collaborative front, we have already discussed a lot of things on the regulatory perspective. Second thing, the integration of technology and the healthcare with the healthcare system that we can discuss, which has a this collaboration, the technology collaboration with the healthcare system is going to be a extremely uh, uh, it's going to be have the extremely good future. We can say it's like a symbiotic relationship of we can say technology with healthcare, which has already we have seen the revolutionary changes of this integration, and the future innovations in this front can be definitely substantial. We can see some technology and healthcare solution collaborations like which has improved the accessibility and affordability. We have seen the telehealthcare solutions in the past, which has broke down the geographical barriers and provided the access of medical expertise to the individual and in the underserved areas. Now we talk about the future potential of this technology collaboration. So the continuous advancement in this sector can enhance the scope of like virtual care, making consultations, monitoring, follow-ups more convenient. Apart from accessibility, they will be making the most cost-effective solutions also, right? We can see the future technologies like 3D printing and personalized medicine. In the past, we have seen that the 3D printing technology has already facilitated the creation of customized medical implants, the prosthetics. They have also contributed to the personalized treatment approaches. The same technology in the future we can expand, and it may lead to more affordable and tailored, we can say tailor-made pharmaceutical products, implants, medical devices, which will align with the precision, with the principle of precision medicine. That's we can explore in the future. uh, the thing we have discussed on the artificial intelligence and the data analytics front. So we have seen the AI collaboration with the healthcare services in the diagnostic segment, in the predictive analysis, improving the efficiency and accuracy of the medical processes. The future in this, we can see the more sophisticated AI can be more sophisticated in the decision support system. the personalized system, personalized treatment plans. They can also improve the operational efficiency. So these all will ultimately reduce the cost and enhance the outcomes.
Right.
The blockchain technology, they have already contributed in the security and the integrity of health data. They have addressed the concerns related to the privacy, data breaches. The future, it can be further enhanced, on the data interoperability things, and contribute to the cost effective and transparent healthcare system.
Right.
The apart from the technology integration with the healthcare, we have already discussed, Prabhat ji and Sharad ji also discussed on the collaborative approaches on the PPP model, which can be a great step towards make more collaborative efforts uh, on the front of accessibility, triple A, as mentioned by the Dr. Rajiv Chhibber, accessibility, affordability, and availability of the solutions. So
Right.
this can be explored. Thank you.
Thank you. Thank you, Dr. Ravi, for your wonderful answer. So, I'd like to thank each of my panelists for sharing their valuable insights on the different initiatives and their recommendations. Now, I'll move over to the last question for each one of you. So, I'll start with Dr. Rajiv. One key take home and a summarization of this panel for this universal health coverage, Dr. Rajiv, we'd like to hear from you.
Um, I think on World UHC Day, we should move towards a larger PPP model, and this is not the regular public-private partnership model that we talk about. It's a model that I would say a partnership for public purpose. Unless that's available, we may not be able to forge ahead. So I think a larger or a new coined PPP model is something that we should be able to look at, and that's particularly with in the context of what Sharad just said, that medical science is now an evolving sector altogether, and we're seeing how affordability and availability is now being pitched at a larger level, both from the industry side, the government side, and even the patient side itself. So I think that's something we should be able to take forward on UHC Day.
Thank you, Dr. Rajiv. Mr. Prabhat, your take home and a summarization for today's panel on UHC, please.
Yeah, I think one is definitely when we talk about access, it's the quality access and also equity in access, because many time access is there if it is not equitable and quality, as Sharad was talking about, let's say in quality of cancer care under Ayushman Bharat, right? The important is that as the pace with which the quality of care is changing, the newer therapies are coming. When we talk about universal access, whether everybody, it's not only about getting access, do everybody gets access which is kind of quality care which really improves their quality of life. It is not that giving something. Yes, it's a start, and I think we have progressed towards that, but now I think this is a time to also see that there is a equity in that healthcare access and quality care.
Right. Thank you, Mr. Prabhat, for your message. Mr. Sharad, over to you. Your take home and a summarization on this UHC panel discussion today, please.
Well, actually, I'll take the word that Prabhat offered and I'll say equity plus innovation plus Ayushman Bharat is equal to universal healthcare in India. If we have these three principles in place, which means everyone is entitled to the very best of healthcare that is available, we work with the government and policymakers through innovative mechanisms and constructs and mindset, and we make all of that happen within an ever expanding Ayushman Bharat program, we will be able to achieve universal healthcare. Absolutely.
Thank you. Thank you, Mr. Sharad, for that answer. Lastly, Dr. Ravi, your summarization and take home for on this UHC,
Yeah.
please.
So, Dr. Nishat, I would say, for example, this year's UHC 2023 theme is health for all, time for action, right? So, the government, needs to take some immediate and tangible steps. So, to enact the policies which guarantee the equitable access to the essential health services. We have discussed on the collaborative front. So, collaboration is the key word we can say here for the universal health coverage and universal health access.
Thank you. Thank you, Dr. Ravi. So with this, I'd like to bring this panel of discussion to a closure. Firstly, I'd like to thank all the audience who have engaged with us. Secondly, I'd like to thank our supporting partners, United Nations Global Compact Network, Parul University, and BR Life for stepping up with Voice of Healthcare in this initiative. Lastly, and most importantly, I'd like to thank my panelists, Dr. Rajiv, Mr. Prabhat, Dr. Monika, Mr. Sharad, and Dr. Ravi. Thank you for sparing your time and coming across with Voice of Healthcare. Voice of Healthcare really appreciates your presence and the sentiment towards health equity that you people have showed. Thank you and have a good day.